Welcome to Plastic Surgery TNA. That's Talking Advice. I'm Dr. Earl Stephenson Jr. of ESJ Aesthetics, where confidence takes shape. This show helps my patients and clients take the plastic surgery journey with expert advice and no fluff. So, today's episode and the question I want to pose is the following: how do you know if your surgeon is really board certified? How do you know? If you don't and you want to learn a couple of easy steps to stay out of trouble, to keep yourself healthy, wealthy, and wise, then stay tuned. I'm going to show you the steps next. You would be shocked about this. Not many people know that their plastic surgeon or their doctor is board certified. They don't know before having the procedure. Here's the kicker, they don't even check. I've had nurses that have had procedures and gotten into trouble and had bad outcomes and end up coming to me who never knew that their doctor was not certified and not certified by the American Board of Plastic Surgery. So if you want to stay healthy, if you want to stay out of trouble, but you're really interested in, transforming, building your confidence, and plastic surgery may be a tool, then stay right here. I'm going to show you just a couple of simple steps that you can take to make sure that the doctor you choose is legit. Here's the kicker. Not every doctor that does tummy tucks or lipo is certified to do so. So if you're interested, stop what you're doing, take a listen. I'll take just a little bit of time. So if you're ready, let's do it. All right. So let me tell you a story. It's a disturbing story that happened right here in Atlanta, Georgia. I'm going to tell you the story of Dr. Chip Cole. He is infamous in Atlanta for having multiple lawsuits from patients concerning botched surgery. He is an ophthalmologist that portrays himself as a plastic surgeon. He has disfigured several patients. He has had his medical license stripped, but subsequently reinstated. He's filed for bankruptcy. He is not certified by the American Board of Plastic Surgery. And on his website, he touts many certifications that look really impressive. But none of them are legitimate. None of them are authorization boards or certifying boards. They don't oversee anything to protect the public. So I can tell you the story, but let me show you an expert or an excerpt of a video done by one of our local news outlets that tells you the tale, horrific tales of Dr. Chip Cole. I'll put a full length link here so you can watch the entire video, but I think this will give you an idea of why it's so important for you to check your doctor's credentials. And if you stick around during this podcast, I'll show you just a couple of easy ways to do so. So on that note, let's get to the video.
When Kayla Cannon wrote this one-star Yelp review accusing an Atlanta eye doctor of damaging her face, it was the first time telling her 2023 plastic surgery story, but she knew it would not be the last. Before we get to how, let's start with Why?
This wasn't cosmetic reasons. This was like a birth defect that I had.
Kayla has no muscle in her eyelids. She sought plastic surgery to lift them up.
They all have advantages and disadvantages.
She went to Dr. Harvey Chip Cole.
He was like, I can fix you, make you even better. That's when he advised the eyelid surgery as well as cheek implants because he said that my cheeks were very flat.
The procedures done at Northside Hospital's outpatient surgery center.
The day of the procedure, how do things go? Seemingly well?
Yes.
Until weeks later.
My eye just dropped instantly. The eyelid back to its normal spot, if not maybe worse.
So Kayla went back for a second surgery, hoping for better. It only got worse, her lawsuit claims. It cites what other consulting doctors say went wrong. Too much tissue removed from her eyes, the areas over-tightened. One of her cheek implants allegedly infected too. The suit saying Dr. Cole failed to recognize and properly treat by not immediately removing it.
I woke up with a complete rash over my left cheek, had a fever, sweats, and he put a syringe to my cheek and pulled out fluid, and it was green.
In response of legal filings, the doctor denies all wrongdoing, arguing the facts are incomplete and out of context with respect to Kayla's medical history. Kayla says other doctors have since helped with new surgeries, but could only do so much. It's left the 29-year-old feeling permanently deformed.
He took all of my 20s away from me, the most important years of my life. I look worse than when I started, and it kills me.
Kayla is not alone in her legal claims of negligence.
Let's be really honest. I'm disfigured.
Patient Sarah Dunham.
I'm embarrassed how I look. I'm embarrassed how I try to talk. I'm embarrassed that I have to keep taking swigs of a liquid to moisturize my mouth to be able to talk to you.
Side effects in surgery, dry mouth, right facial paralysis, impaired eating and drinking, even the inability to close either eye, her lawsuit documents. It dates back to 2022.
I wanted to look a little refreshed. All I asked was just this to be tightened a little.
But she alleges Dr. Cole recommended even more procedures. Sarah's surgery included a cheek lift, lip lift, eyelid, and ear pinning surgery. She's accusing Dr. Cole of damaging facial nerve and removing too much tissue.
Why is it so important for you to share your experience?
I don't want him to continue to do it to other people.
Other people have already come forward. At least 7 additional patients filed lawsuits claiming they're deformed after plastic surgery with Dr. Cole.
Oh, that's not right.
Attorney Alex C.
They went to him to make things better, and all he did was make them worse.
C represents all the patients which Dr. Cole's lawyer says there's grave concerns about, that Dr. Cole questions how it is possible that a single plaintiff's attorney has been retained by several former patients, adding Cole will fight the claims against him.
You see a pattern in practice of upselling patients for procedures that they don't need, they didn't need, and then on top of that, doing those procedures incorrectly.
Since the civil suits seeking payment for damages, records show Cole filed Chapter 7 bankruptcy, a legal process declaring he's in debt and selling off assets. That's his financial background. But his professional background? Atlanta News First Investigates found the doctor is not American Board of Plastic Surgery certified. Although the board is an independent, non-regulatory organization, experts consider it the gold standard certification for its strict training and examination methods. Cole does have 3 other certifications from the American Boards of Cosmetic Surgery, Laser Surgery, and Ophthalmology. Although his Georgia medical license profile states he's also board certified by the American Society of Oculofacial Plastic Surgery, the organization's website says it is not a certifying or accrediting body. The Georgia Medical Board would not confirm whether it's investigating or not. However, these patients say they've filed complaints telling investigators they are now forever scarred in more ways than one.
We're supposed to trust these people and trusting that what they're doing is the right protocol.
It's hard to look at. It's hard for you, it's hard for me, it's hard for anybody else. That doesn't go away.
The Georgia Medical Board would not confirm or deny an investigation, but said if action is taken against the doctor, it would be made public. Dr. Cole maintains he is quadruple board certified and has trained numerous doctors in his 35-year career. Northside Hospital is also named as a defendant in these lawsuits, accused of wrongfully allowing Dr. Cole to perform surgeries there. In court filings, the hospital denies all wrongdoing, but in a statement to Atlanta News First, a spokesperson said he no longer has privileges there. In the studio, I'm Sarah Cummings. Atlanta News First investigates.
Wow, devastating. Just devastating. You do not want to be on the other end of someone's scalpel, someone's knife, who is not qualified. This is why I'm doing this. You don't have to come to me, but you got to see a plastic surgeon that is certified by the American Board of Plastic Surgery. It matters. Certification matters. If you don't hear anything else from me tonight, this morning, this afternoon, whatever time it is you're watching this, certification matters. And it matters as a board certified plastic surgeon, certified by the American Board of Plastic Surgery. Why does it matter so much? Because that process of certification by the American Board of Plastic Surgery, which is, by the way, recognized by the American Medical Association, is a certifying board that is interested in the safety of the practice of plastic surgery. It's there to protect you. It requires someone like me, after a couple of years of training in plastic surgery, to come and sit and take very difficult oral examinations, then to take very difficult verbal or written examinations. Once I pass that oral examination and written examination, I'm board certified. And what that really means, that the thought leaders that that provide these examinations under the umbrella of the American Board of Plastic Surgery are thought leaders that have written the textbooks, have done the benchtop and clinical research, who are innovators in the specialty. Those brilliant minds come together to make sure that safety in the field of plastic surgery is paramount. And so they test and work hard and work over plastic surgeons in the community and in academia to make sure that when they are safe to practice. You'll see all over social media, on different platforms, debates back and forth between the American Board of Plastic Surgery, or surgeons certified by that board, and the American Board of Cosmetic Surgery, which is not a certifying board, which is not recognized by the American Medical Association. Sadly, many doctors cloak themselves under that umbrella of the American Board of Cosmetic Surgery. These surgeons or these doctors may be OBGYNs by nature. They may be ER doctors by nature. They can even be dentists. And I don't mean like your general dentist doing fillings. I mean oral surgeons who have some surgical, oral, or dental training, parading, masquerading as plastic surgeons. They can legally do this. They can legally have the title of cosmetic surgeon, but that doesn't mean they're qualified. It doesn't mean they have not been tested, not been observed, not been trained, not had the actual surgical experience that is provided in a plastic surgery residency or fellowship. Let me just explain that very briefly, because then I will compare that to a cosmetic surgery fellowship. So I'm going to digress a bit. So if your plastic surgeon has completed a plastic surgery residency, that means they typically have come right out of medical school and they've done 5 to 6 years of plastic surgery training, which also includes general surgery. Then they can then go out to practice, sit for their oral and written examinations, and hopefully pass and become certified by the American Board of Plastic Surgery. There are different subset, equal, but different subset or different pathway. That's probably the better term, different pathway for plastic surgeons that complete a plastic surgery fellowship like myself. Those individuals completed a core medical specialty and in some case a core dental specialty training, and then went on to receive training in plastic surgery for 2 to 3 years. So example, someone will train in general surgery for 5 to 6 years and then go on, if selected by a selection process, which is very competitive, to train in plastic surgery for 2 to 3 years. Or they may train in neurosurgery for 7 years and go through that same process and train in plastic surgery for 2 to 3 years, or ENT surgery for 5 years and train in plastic surgery for 2 to 3 years, or or urology and train for 5 years and then finish up with plastic surgery for 2 to 3 years. Or in my case, train in oral and maxillofacial surgery. I have a dental degree, but I also had then to get a medical degree and then train in 2 to 3 years of general surgery and then train in 2 to 3 years of plastic surgery after completing, or let me say this again. I had to complete dental school. I had to complete medical school. I had to then do 4 years of oral and maxillofacial surgery training, 2 to 3 years of general surgery training in my case, and then 2 to 3 years or 2 years specifically for me in plastic surgery. So the fellowship pathway or the direct pathway are very, very daunting and are long. Someone who's trained in cosmetic surgery or cosmetic fellowship under the guise of the American Board of Cosmetic Surgery trains for 1 to 2 years, mainly 1 year, after finishing an ER residency or emergency medicine residency, which don't do surgery. They don't go to the operating room ever during that 3-year residency. Or OBGYN, that they do go to surgery for gynecologic procedures, but they don't do core general surgery, which I think is, as a intern, you need to do. You need to know how to take care of sick patients and manage patients before surgery, after surgery, and get ICU experience. They don't do that. But they can go on and complete those residencies and others outside of the core surgical ones that I mentioned, ENT, general surgery, oral and maxillofacial surgery with a medical degree, urology, neurosurgery. They can go, those OBGYNs can go on, and I'll use that as an example, or ER physicians go on and do a cosmetic surgery fellowship for 1 year, where they effectively are a glorified assistant in many cases. Many times, these fellowships are based in private practices where private practitioners are not going to allow their patients to be operated on by trainees. Those people who are, or doctors who are training in the cosmetic surgery fellowship model, are holding retractors, seeing patients pre-surgery, after surgery, making phone calls during surgery, assisting, suctioning, maybe doing a tiny bit of the surgery, but certainly not the critical parts of the surgery, cutting sutures, putting on bandages, writing uh, instructions, giving prescriptions. And at the completion of that, they are trained and they go and unleashed on the public. Again, still doesn't mean they're qualified. They don't sit for any rigorous exams. The Even if they did, I don't even know if the American Board of Cosmetic Surgery has an oral examination or a verbal examination, oral examination or a written examination. But it doesn't matter because the American Medical Association doesn't recognize it. It just doesn't matter. So they're not qualified. And so the key points when you're looking at a doctor, you want to make sure if they say they're boarded by the American Board of Cosmetic Surgeons, anyone with a medical license can call themselves a cosmetic surgeon. Remember that. That's point one. Point two, if that doctor is certified by the American Board of Plastic Surgeons, then that means they've literally sat for a torturous written examination that covers all the facets of plastic surgery, core principles of plastic surgery, comprehensive surgical management, cranial maxillofacial surgery, hand surgery, burn surgery, lower extremity surgery, and aesthetic surgery, pediatric plastic surgery. All these things we are questioned about and trained on. And once we pass that written exam, then we have to collect cases and then present those cases in which we've operated on people and defend them in the oral exam many years later. And then at that same exam, we are given unknown patients and have to work through problems and complications and how we would manage those complications and those patients. And if our thought leaders, our innovators say that we are safe and that we have logical reason, we have good reasoning, we function logically, we don't take risks, we don't operate on people who aren't candidates, we don't go rogue outside of the principles of plastic surgery, the principles of core surgery, which is really general surgery, then they stamp us with certified by the American Board of Plastic Surgery. So that's why it matters. That's why it matters. So if you are interested in staying safe, again, I say that if you're interested in staying safe, I'm going to show you 2 ways that you can check the doctor that you're interested in, who has all the great results, who has thousands, if not millions, of Instagram followers or TikTok videos where they're twerking and all the other things. No matter how popular they may be, how funny they may be, how silly they may be, you can just do 2 simple things by getting on your phone or getting on your laptop. And here are the 2 steps. So let's start with step number 1. Okay, let's check to see if your surgeon is certified by the American Board of Plastic Surgery. Simple. Go to certificationmatters.org. You can see all the specialty boards that are recognized by the American Medical Association. We simply, on this site, scroll down to the section, Is My Doctor Board Certified? You can enter your chosen doctor's first and last name, the state in which they live, and their specialty or subspecialty. You can see there's a drop down with a list of ton of specialties and subspecialties recognized by the American Medical Association. As we get to the specialties and subspecialties that are or that start with the letter C, you do not see cosmetic surgery because it is not, and I repeat, it is not a recognized standalone subspecialty or specialty by the American Medical Association. So do not be fooled by practitioners that are saying they are board certified by the American Board of Cosmetic Surgery. They are simply not telling you the truth. They may be certified by that organization, but it is not a recognized organization by the American Medical Association. So let's show an example. Let's scroll down to plastic surgery, and I'll use myself as the example, of course. We'll go to the state. I'm located in Georgia. We'll type in my last name. and then of course my first name, and then move right over to find my doctor. I should come up readily, and there I am with my name, my reported location, and my certification in plastic surgery. If you wanted to take a deeper dive of my profile, you can simply click and you'll see that I'm certified by the American Board of Plastic Surgery and additional information about my certification. Okay, easy peasy. Step number one, Certification Matters website. Pretty straightforward. So if you want to really kind of cement the deal, feel really good about it, let's go to the horses, straight to the horse's mouth, as my mama would say. Let's go to the American Board of Plastic Surgery website. That is step number two. So I'm going to walk you through that right now. Okay, let's look at another way you can check to see if your surgeon is board certified by the American Board of Plastic Surgery. You simply go to the American Board of Plastic Surgery's website. You can type that into your search bar on Google. Once you get to the home page, you go to Public, and then there's a drop-down list that shows verification, FAQs, what the certification is, continuous certification, and other links that are important. So step one, go to the verification. This should bring you to a page with the logo for the American Board of Plastic Surgery, and it will have at the bottom 2 ways in which you can check a surgeon. And let's discuss the first way. So the first way, you can type in the surgeon's first and last name if you have a surgeon or a couple of surgeons in mind. You'll have to do them one by one, obviously. So I'll use myself as the example. Let's type in my last name, then my first name, and hit search. Oh, there may be a code that you need to enter so that the system knows you're not a robot. And submit. Okay, so there you have it. Bam. Gives you my name, my address for my office, my certification status, which says certified. And it gives the history of my certification process, my recertification, and my upcoming certification. And it then shows that my certification is active. So that's all. And if you have another surgeon in mind, you just clear that and type in that surgeon's name. Now, if you don't have a surgeon in mind and you live in a particular area or state or city, you can search that particular area for surgeons that are certified by the American Board of Plastic Surgery. So you just put in your state. And for example, let's just go with the state of Ohio. So we'll drop down, we'll click Ohio. And then of course it's the United States. And then we will type in or select the drop down for the radius of the search. We'll check 50 miles, we'll try to do a broad search. And then we'll finally put in the zip code of the area that we are interested in finding our board certified plastic surgeon. So we did a little research, and I think I'm going to type in the Cincinnati, Ohio area code. So let's type that in. Okay, there we go. And you just simply hit search. It says that 79 matches were found. It's too numerous for this page, so we'll have to refine our radius a little bit. So let's pare it down to just 10 miles. What do we decide to do? So let's pare it down. Yeah, 10. There we go. And let's search. So there we have it. We have a list of all the board certified plastic surgeons, meaning certified by the American Board of Plastic Surgery within a 10-mile radius, excuse me, of Cincinnati, Ohio. So, if you're unsure as to who you may choose, you can have a broader list. So, again, this is just another way, a second method, and probably the most reliable method that you can use to guarantee that your surgeon or the surgeons that you're interested in are certified by the American Board of Plastic Surgery. Okay, pretty simple. Just two steps. Gives you a lot of information, gives you a lot of power so that you know who you're dealing with. Now, I'm going to give you again a disclaimer. You can be certified by the American Board of Plastic Surgery and perform a tummy tuck, and your patient can have an infection. The kicker here is you know how to recognize the infection, you know how to treat the infection, you know when the infection is very serious and know how to treat it and bring in other colleagues to help with their portion of the management. You have a portion. You don't just punt the patient, you have a portion. So that's to me where the rubber meets the road. That's where that certification really shines through. You know how to manage complications. You're still a part of the patient journey and care, and you're providing your expertise to get that patient, that client to the other side. So don't be fooled. So here are a couple of red flags that I want you to kind of flag yourself. First, board certification in the cosmetic surgery. This is not legit. This is not the American Board of Plastic Surgery. Fellow of the American Academy of Cosmetic Surgery sounds wonderful and impressive, but it's not a true board. So don't get fooled by that. A big fancy office, ads in glossy magazines, big social media following is great, but you got to make sure that they have the proper credentials. That means plastic surgery residency or fellowship training and board certification by the American Board of Plastic Surgery. So do your research. If you're not sure that your surgeon is qualified, and maybe you've even made the consult, or you're in the consult, here's a couple things you can do. One, if you are unsure and you have it and you've already seen the doctor and you don't really get the straight answer or you're unsure, everybody's welcome to get a second opinion. Now, it may cost you another consult fee and you'll have to weigh that out yourself based on your situation and your finances, but please get a second opinion. Even if you see a plastic surgeon certified by the American Board of Plastic Surgery. Get a second opinion. Get 2 to 3 consults. Don't, if you are fall in love, and I'm using that kind of civilly, if you fall in love with your surgeon and you know who that's who you want and you check them out and they are qualified and you're good, the first time around, great. But again, make sure they're qualified by the American Board of Plastic Surgery and they completed a plastic surgery residency. But if you're still unsure, you want to compare doctors' experiences, their recommendations, and even their fees. I don't recommend or condone price shopping because price people are price sensitive. We all are, but this is your health, your life. So get the second opinion. Don't be afraid to ask questions during your consultation. Or if you made a consultation, you found out that your doctor is or that doctor is not certified by the American Board of Plastic Surgery, cancel the appointment. Some doctors will charge you for that. I mean, hopefully you know that before you make the appointment, but it believe me, if they charge you $25, $100, it may be well worth it if you end up with a bad problem. It's going to cost you more than $100. So if you're unsure, you've made the appointment, cancel it. If you're in the consultation and you can ask the doctor directly, which is the best way, ask him or her, where'd you do your plastic surgery training? And they can give you the answer. Then you can go to Google just like you would do and just Google that training program if it exists. So you can just simply ask, where did you do your plastic surgery training? And then obviously, as I've been just shouting to the rooftops here, you can just ask, are you certified by the American Board of Plastic Surgery? It's pretty simple. Get a second opinion if you feel that you're not quite comfortable. If you've made an appointment and you're not comfortable and you can't find the credentials that you like, the American Board of Plastic Surgery credentials, then cancel the appointment. If you're in the midst of the consultation, ask the doctor directly, where did you do your plastic surgery residency? And are you certified by the American Board of Plastic Surgery? It's really pretty straightforward. So you have been empowered. Again, I would love for you to work with me. But if you don't or you can't, it's okay. If you're in Wichita, Kansas, make sure the doc is certified by the American Board of Plastic Surgery. If you're in Dallas, Texas, if you're in Waco, Texas, if you're in Boston, Massachusetts, Fort Lauderdale, Florida, you get my drift. And you can just simply go to the American Board of Medical Specialties website or the Certification Matters website. And you must and most definitely should always go to the American Board of Plastic Surgery website. On that note, it's been great. It's been real. I hope you've enjoyed this podcast. It's a little different. If you like it, tell me about it. If you hate it, tell me about it. If you don't know, check out some more. Come back next week. I would love to have you. If you're new, subscribe. I really would appreciate it. If you're returning, thank you so much. I really appreciate it. If you are interested in working with me, I encourage you to go to my website. And that is simply, and I'll pull that up so that it's right here. You don't even have to chase it. It's straight, no chaser. Website, bam. www.ESJ Aesthetics. You can check it out. I try to be transparent, just like I'm transparent here. I've got pricing on my website. I've got pricing for my consultation fee is $225. I got pricing or starting prices and ranges for all of my procedures that I perform. We've got blogs, we've got videos, we've got before and after pictures, we've got FAQs, we've got stuff on me. So you can really check me out. If you check me out and you like what you see and you wanted to take the next step, it's pretty simple. We offer in-office consultations. We offer virtual consultations. So you can start by just calling the office at 770-466-4700. We'd be happy to set you up with a in-office or virtual consultation. So on that note, please tune into our episode next week. And until that time, stay safe. Wherever you are in the world, spread good energy. Be kind. Until next time, peace.